Hello everyone, welcome back to my channel. In the previous video, we have seen about medical surgical nursing important bits. So this is a continuation, part 2. There is an increased risk of developing cancer of the tongue in a patient with a history of heavy consumption of alcohol, frequent gum chewing, poor dental habits, nail biting. So cancer of the tongue due to heavy consumption of the alcohol. The major post-transfusion viral hepatitis is hepatitis D, hepatitis C, hepatitis A, hepatitis B. And the answer is hepatitis C. Vitamins are administered parenteral for the clients with an inflamed intestine because intestinal absorption may be inadequate, rapidly absorbed, intolerate orally, decrease colon irritability. And the answer is intestinal absorption may be inadequate. Exchange of respiratory gases, oxygen and carbon dioxide takes place through respiratory surface in the form of osmosis, diffusion, reverse osmosis, active transport. And the answer is diffusion. Which bacteria cause the whooping cough? Mycobacterium, Corynebacterium pertussis, Bordetella pertussis, Salmonella typhi. And the answer is Bordetella pertussis. Choanal atresia is an anomaly located in anal area, nasopharynx, intestinal tract, pharynx and larynx. And the answer is nasopharynx. Which of the following symptoms should be referred to the pulmonary clinic for suspected tuberculosis? Chest pain, increased cough and weight gain, hemoptysis, increased cough and weight gain, nausea, vomiting and weight loss. Next, hemoptysis, increased cough and night sweat. And the answer is chest pain, increased cough and weight gain. In a client with atelectasis, what would be expected? Slow, deep respiration, diminished respiration, dry and productive cough, fast and short respiration. And the answer is diminished respiration in atelectasis client. The most reliable index to determine the respiratory status of the client is to observe the chest rising and falling, observe the skin color, listen and feel the air movement, observe the tongue color. And the answer is listen and feel the air movement. It is a reliable index. Under normal physiological condition, the respiratory center is stimulated by calcium ion, carbon dioxide, oxygen, lactic acid. And the answer is carbon dioxide. The most critical factor in the immediate care of an infant after repair of cleft lip would be prevention of vomiting, maintenance of airway, administering parenteral fluids, administration of medication to reduce oral secretion. And the answer is administering parenteral fluids. This is for the infant after repair of the cleft lip. Which of the following nursing diagnosis has the highest priority for the client of pneumonia? Impaired gas exchange, altered oral mucous membrane, altered nutrition less than body requirement, activity intolerance. For pneumonia, it will be impaired gas exchange. Oxygen and carbon dioxide are exchanged in the lung by diffusion, active transport, osmosis, both osmosis and diffusion. Already it is finished, previously it is diffusion. Ambu bag is used in the intensive care unit primarily when a respiratory arrest occurs, a client is on ventricular fibrillation, the respiratory output must be monitored, a surgical incision with copious drainage is present. And the answer is when a respiratory arrest occurs. While caring for a client with hepatitis A, the nurse should take special precaution to use gloves when removing the client's bedpan, wear mask and gown before entering the room, prevent droplet spread of infection, stay away while caring the patient. So, for hepatitis A patient, it can be fecal-oral route. That's why use gloves when removing the client's bedpan. The gavage tube inserted to the client should be placed in high Fowler's position, semi-Fowler's position, supine position, Sims position. And the answer is high Fowler's position. Ingestion of fatty foods cause discomfort in the client with cholelithiasis because fats are hard to digest, bile flow in the intestine is obstructed, not formation of bile, none of them. And the answer is bile flow in the intestine is obstructed. Development of obstructive jaundice is evidenced by inadequate absorption of fat-soluble vitamin A, light amber urine, dark brown stool and yellow skin, dark colored urine, clay colored stool, dark and itchy skin, straw colored urine, putty colored stool and yellow sclera. And the answer is dark colored urine, clay colored stool, dark and itchy skin. Clients with gastrectomy may develop pernicious anemia because vitamin B12 is only absorbed in the stomach, the hemopoietic factor is secreted in the stomach, the parietal cell of the gastric mucosa secrete intrinsic factor, chief cell in the stomach secretes intrinsic factor. And the answer is the parietal cell of the gastric mucosa secrete intrinsic factor. Phosphor soda is a cathartic, classified as saline, emollient, stimulant, bulk forming. And the answer is it is saline. The dumping syndrome refers to nausea due to full stomach, rapid passage of osmotic fluid into the jejunum, reflux of intestinal content into the esophagus, buildup of feces and gas within the large intestine. Answer is rapid passage of osmotic fluid into the jejunum. We call it as dumping syndrome. Fracture mandible is usually immobilized with wires. The life-threatening postoperative problem that can develop with the procedure is diarrhea, paralysis, infection, vomiting. And the answer is vomiting. Assessment for sign of respiratory complication is important following cholecystectomy because incision is in close proximity to the diaphragm. Length of urine required or surgery is too prolonged. Client's resistance is lowered because of bile blood. Bloodstream is invaded by microorganism from the biliary tract. And the answer is bloodstream is invaded by the microorganism from the biliary tract. Before scheduling a client for endoscopic retrograde cholangiopancreatography, the nurse should assess the client's bilirubin level, serum glucose, urine output, pulse. And the answer is bilirubin level. The chief complaint in the client with Vincent's angina is bleeding oral ulceration, chest pain, shortness of breath, left hand pain. Vincent's angina, bleeding oral ulceration. The visualization of the GI tract after a barium enema is made possible because barium physically colors the intestinal wall. Barium has the X-ray transmitting properties. Barium chemical interact with electrolytes. Barium has the X-ray absorbing properties. Answer is barium has the X-ray absorbing properties. A client with ascites has been ordered paracentesis. Before the procedure, the nurse should instruct the client to assume supine position, assume lateral position, empty the bladder, remain nothing per oral for 12 hours. Answer is empty the bladder. A client who has had a colostomy should follow a diet that is as close to normal as possible, rich fat, rich protein, rich carbohydrate. As close to normal as possible. Abdominal discomfort by ingestion of milk may be the result of genetic deficiency of enzyme lactase, maltase, amylase, sucrose. And the answer is lactase. Which of the following is essential for the absorption of fat-soluble vitamins in intestine? Bile salt, lipase, hydrochloric acid, amylase. Essential for absorption of fat-soluble vitamins, that is bile salt. A readily form of energy stored in the liver by the conversion of glucose to starch, glycogen, fatty acid, amino acid? And the answer is glycogen. There are 8 essential amino acids. This means these are formed in the body. These are formed in the body and essential for growth. These are not formed in the body and obtained from the diet. These are essential for life. And the answer is these are not formed in the body and obtained from the diet. In hemorrhoidectomy, postoperative care should be given. Administration of laxatives and stool softeners, administration of enemas to promote defecation, dressing of area, encouraging shower if needed. So here, administration of laxatives and stool softeners. Barium enema serves to illuminate the alimentary canal, dye the alimentary tract and provide color contrast, give off visible light and illuminate the alimentary tract, absorbs X-rays and thus give contrast to the soft tissue of the alimentary tract. And the answer is absorbs X-rays and gives contrast to the soft tissues of alimentary tract. Intersusception is of the intestine. Telescoping of a proximal loop of bowel into a distal loop, kinking of the bowel into itself, connective tissue compressing the bowel, protrusion of an organ into another. It is a telescoping of a proximal loop of bowel into distal loop. While administering the enema, the height of the container should be 15 centimeters, 25 centimeters, 35 centimeters, 45 centimeters. It should be 45 centimeters. When performing colostomy irrigation, nurse inserts the catheter into the stoma to 2 centimeters, 5 centimeters, 10 centimeters, 15 centimeters. It is 5 centimeters. Pacemaker serves the function normally performed by sinoatrial node, AV node, atrioventricular node, bundle of His, none of them. Pacemaker, that is sinoatrial node. Following a streptococcal infection disorder characterized by swollen Job's fever and death is the possibility of endocarditis, that is mumps, measles, rheumatic fever, rubella. So it is rheumatic fever. Test for diagnosis of varicose vein is angiography, arteriography, Trendelenburg test, Rothra's test. Answer is Trendelenburg test. To record central venous pressure reading, the nurse should place the client in supine position, dorsal recumbent position, side opposite to manometer, Fowler's position. And the answer is dorsal recumbent position for CVP reading. In a client on bed rest, the pulmonary embolus can be prevented by limiting the client's fluid intake, encouraging deep breathing and coughing, using the kneecap when the client is in bed, teaching the client to move the legs when in blood. So pulmonary embolism, teaching the client to move the legs when in blood because the clot can move from legs to the lungs. Orthostatic hypotension can be modified by wearing support continuously, lying down for 30 minutes after taking medicine, avoiding tasks that require high energy expenditure, sitting on the edge of the bed a short time before arising. So orthostatic hypotension, it is sitting on the edge of the bed a short time before arising. Which of the following is also known as pacemaker of endocrine gland? Thyroxine, insulin, glucagon, adrenaline. It is thyroxine. Pineal gland is situated in brain, kidney, liver, stomach. It is brain. Which one of the gland disappears during old age? Pituitary, pancreas, adrenal, thymus. Answer is thymus. Production of which one of the following is a function of liver? Insulin, urea, glucagon, ptyalin. Answer is urea, function of liver. Lifespan of WBC is approximately 48 hours, 120 days, 80 days, 24 hours. Answer is 48 hours. Tinnitus is a symptom that is objective, functional, prodromal, subjective. It is a subjective symptom. Infection from retention catheter can be best prevented by irrigating the catheter once daily, Change the catheter daily, encouraging adequate fluid. Cleansing around the meatus periodically. So cleansing around the meatus periodically. The removal of stone from the urinary bladder. Cystotomy, cholelithotomy, cholecystectomy, cystolithectomy. It is cystolithectomy. In what condition hemodialysis is needed for chronic renal failure patient? Acidosis, alkalosis, hypokalemia, hyperkalemia. And the answer is hyperkalemia. Myoglobin contains copper, silver, iron, nickel. And the answer is copper. Normal temperature of human body on the Kelvin scale is 37, 310, 98, 280. It is 37. Blood is an connective tissue, epithelial tissue, dense tissue, none of them. And the answer is connective tissue. So that's all for this video. This is all about MSN bits. So for psychiatric subject and other subjects, please subscribe and like this video.